Hi, David. How are you?
Hi, Mr. Carr. I'm fine, thank you.
I'm also good.
Mm-hmm.
Yeah, just waiting for the participants.
Good. We've confirmed our audio are well. Now you can put up
Let
the
me try
slide.
to. Yes.
Yeah, then now we wait on top of
All
that.
right.
Okay.
Thank you. David, another confirmation, please. Is my screen moving?
I can see the car. Yeah. Now it's moving. Well.
All right. Okay.
Yeah. Good evening, ladies and gentlemen. Welcome, all professionals from different corners. Welcome to this evening's webinar. And today we have an exciting topic that we want to tackle with our presenter, well-versed with knowledge on QMS. We're going to talk about optimizing competence assessment in clinical laboratories. And for our standard, probably that will be clause 6.2.2 on resource requirement and competence requirements. But we'll dive deeper into that with our presenter this evening. So before we start, I want to tell each of us, our presenter will handle questions on the matters that will be arising from what we'll be discussing. Kindly submit your questions on the Q&A chat box, on the Q&A link, and all your questions will be answered by the end of this particular webinar. So for this evening, our presenter is one of us and is not a visitor here. He's been here before, and we all know him. For purposes of introduction, his name is Mr. Paul Kahara. Mr. Paul Kahara is a distinguished healthcare quality specialist, and so far he has over 10 years of experience in quality management systems for medical laboratories. He holds a Bachelor of Degree in MLS. He is also registered by the KMLTTB and currently is pursuing his master's degree in HSM, Health System Management, at Kenya Methodist University. Currently, Mr. Kahara is the lead consultant at Raquel Consulting Group, where he oversees training and consultancy in QMS and OSHE. He is also a technical assessor with the Kenya Accreditation Services, that's KENAS, where he renders services on need basis for ISO standard 15189-2022, as well as ISO IC 17043 of 2023. Mr. Kara previously, he has served as a quality and technical manager at the UCAS, and proudly he has successfully led multiple ISO 17043 reaccreditations and surveillance assessments, as well as supporting other laboratories in ISO 15189. He has also worked as a medical laboratory officer in Aga Khan, whereby he has pursued and sustained accreditation to 15189 that was under the SANAS. Currently, he is leading the operations at Raquel Consultants Group, where he has made notable strides. So in the past 1 year alone, he has trained over 450 healthcare professionals. That's across 17 African countries, 2 South American countries, 3 Middle Eastern countries, as well as 2 Asian countries, majority of whom are medical laboratory professionals. So he has extensive knowledge and practical expertise as a trainer, an implementer, and assessor in 15189 ISO, in ISO 17043, as well as ISO 9001. He has also a lot of expertise in the implementation of the Kenya Quality Model for Health and other safe care standards. He has shown a lot of passion in healthcare systems, and that's why we have him this evening to discuss with us on staff competencies, which is the backbone of every institution or every organization, whereby we believe, we also as a Kamulso, that once we empower our professionals who are the human resource, we improve the organizations and as well as individual capacities. So, Mr. Paul, welcome. You can take the mic. And for more questions and interactions, let's interact on the chat box, but for questions, let's have them at the Q&A. Paul, take on.
Okay, thank you, David. I'm so delighted to be with you here tonight. Good evening, colleagues. Thank you so much for finding time to have me discuss with you on competency assessments in clinical laboratories. The title of our standard is actually Medical Laboratories Requirements for Quality and Competence. And therefore, competence occupies the heart of the standard that guides medical laboratories, especially for quality management systems. So this evening, I will be engaging you on just a few areas, probably in 20 minutes, and then allow you a few minutes to probably ask a few questions. I'll be able to answer those that I can, and those that I may not be able to answer this evening, we can always engage and talk more about it. So I will do a quick introduction on what is competency assessment vis-a-vis performance appraisal, or as we call it, staff performance evaluation. We'll have a look at some of the requirements of ISO 15189, the version of 2022, when it comes to competency assessment. We'll have a look at effective methods that we can make use of to assess competency of our personnel and the laboratories generally. And then I will go ahead to suggest probably a competency rating scale and a competency assessment tool that we can use in our different facilities to assess how good our personnel are doing in terms of applying the skills. And then I will share a few strategies on how to make good use of competency assessment in clinical laboratories, and probably we'll be able to hear a few questions from you. So as part of introduction, it is good to say that competency is not a concept that is only used in medical laboratories. It is used in so many professions and so many fields. For example, when you're driving your vehicle and someone hits you from behind, the first thing that you're likely to ask them is, my friend, do you know where the brake pedals are? Where were you rushing to? Are you really competent as a driver? That is one of the questions that you're likely to ask this driver who hits you from behind. Without considering all other factors, you see accidents, we will always assume that probably the driver is not competent. You have heard this term used even among the politicians. Of course, we know the politicians uses that term whenever they want to achieve probably sometimes something malicious. And you have heard this, in our parliament, where some members would say, we are filing an impeachment motion because you have demonstrated incompetence, either as a president, as a CS, whoever that works for government. If MPs want to show their muscles, they'll always mention, we want to impeach you based on incompetence. You have even heard parents complaining and even carrying placards to different schools, especially after exams, saying that they want that headmaster, that head teacher moved from that school because it is underperforming because of their incompetence as managers in that school. So competency is a concept that we use across all the fields. Back in 2017, the former governor of Murang'a County, for those of us who are not coming from Kenya, Murang'a County is probably 2 hours away from Nairobi. He complained that, some of his lab professionals in different county hospitals were not testing even simple tests like amoeba in the county facilities. And they were, moving these samples to private facilities. I don't know whether it was out of incompetence or it was out of other needs. And so incompetence is a term that we use so oftenly in our field, in medical laboratory, and even in other fields like I have demonstrated to you. So what is competence? Competency is that demonstrated ability to apply knowledge and skills to achieve an intended result. We will say you know how to evaluate or to test malaria if we can confirm that you are trained, and when we give you that slide that either has or does not have malaria, you will report to us accordingly. So we are going to regard you as a competent personnel if you are able to apply the knowledge and the skills that you have to achieve the desired results that you want to have. Now, competency assessment is that systematic process to verify that a personnel possesses the knowledge, the skills, and sometimes even the behaviors that are required to perform the assigned task, both effectively and consistently. Now, performance differs somehow from competence because you can be competent and not able to perform. Now, performance is that observable practical application of competence in real-world situations. You could be knowing how to test malaria, but you only do one sample in a day and you get so tired or you get so interrupted that you're not able to analyze as many samples as as the patients are coming to the facility. You may be very good, in doing audits. You may be very good in doing quality controls, but anytime you run them, or anytime you perform an audit, we don't see that ability coming out so clearly. So performance evaluation, or what we commonly call appraisal, is the review of an individual's overall job performance, and it often integrates competency, of course, with other performance indicators such as punctuality, teamwork, initiative, timeliness, number of tasks performed. Probably you can even talk about revenue generated. We can also hear from the people that you have served, asking for customer feedback. So appraisal or performance goes beyond just checking the ability to apply knowledge and skills, but also looking at the outcome. Are you able to use that competence to help us in terms of what we are doing as a facility? Now, why is it important to do competency assessment in our facilities? First of all, it helps us to identify weak areas among our staff. You might believe that these staff, they went to the best of the best schools around, and so we expect them to be performing well all the time. But these personnel, probably there's one area or another that they are not so good at. So we want to identify the weak areas of these personnel. We want to use this competency assessment as a support mechanism for continuous improvement and also compliance to 15189 and other regulatory guidelines. We want to ensure accuracy and reliability of test results. Why we bother ourselves so much with a competency assessment is because we want to give out results that can be relied upon by our patients and other users. We want to build trust with our clinicians, our patients, regulators, and any other stakeholders who works closely with the laboratory. Through competency assessment, it also helps to minimize risk of errors and patient harm. And finally, it is a tool for doing staff development, because once we have identified these errors or these areas where the staff needs to improve or to do better, then we'll be able to train them properly, and that will result into self-confidence and even motivation among personnel. Okay, so what does ISO 15189 say about competency assessment? So allow me to talk about the requirements and also quickly talk about what you need to do to satisfy those requirements. So first, the issues of competency are well described in clause 6.2.2, which is under resource requirements, and the second resource here is personnel. Now, the first thing is that the lab shall specify the competency requirements for each function. Now, when the standard talks about function, it is referring to the different roles: medical laboratory personnel, the medical laboratory officers, the receptionist, the quality officer, the safety officer, any personnel who works in the laboratory. The standard requires that we specify what are the minimum levels of competency that need that personnel to achieve. And that should be for any function or any personnel who influences laboratory results in one way or another. Now, the categories of those requirements are as follows. First is about education. What is the minimum competency level for education? What about qualification, training, retraining, technical knowledge, skills, and experience? And I have tried to categorize those requirements and what probably we can do as a lab. Now, first thing, when you hear the standard saying or telling you to specify, it means you need to document somewhere. What are these minimum, qualifications for this personnel? And so we can go ahead and document an SOP for personnel management to satisfy that requirement. When we are told about education, this refers to the different courses that you want that laboratory personnel to have completed. We understand that laboratories are growing big and bigger every day. And so they're not only run by medical laboratory scientists only. We have statisticians, we have microbiologists in our laboratories, we have different professionals. And so for every function, we need to define what is the education that we are looking for. In terms of qualification, when the standard tells you about qualification, this could be probably the level of education. For example, is it a diploma that you want? Is it a BSc? Is it a master's? Is it a PhD? Sometimes for lab directors. Do you want a particular achievement in that course? Probably a distinction or a pass. That's what you need to specify in your procedure for personnel management, or whatever name that you want to give it. On training, it is up to you again as a laboratory to define what are these specific trainings that you want the different functions or the different roles or the different personnel in the laboratory to have trained, either before you engage them for employment or during the process of, or during the course of their employment. And sometimes some of these trainings require retraining. For instance, if one of your staff is trained as a malaria microscopist, we know that this training certificate is not valid all the years. They'll have to retrain, to refresh probably after every 2 years to confirm that they still know how to do malaria testing. It could be TB microscopy, HIV testing algorithms. We know they keep changing. Now, technical knowledge may be on a specific field. Let's say you are looking to have a personnel who will be operating your molecular laboratory, probably for HIV viral load. And so you want them to have some specific technical knowledge on that area. The skills are now any other probably soft skills that you want these personnel to have before you engage them. It could be communication, both written and verbal. It could be emotional intelligence, especially for managers. And so these skills that you want every function to have should be specified in your SOP for personnel. And then finally, when the standard says that we shall specify the competence requirements, including experience, different functions, different roles in the laboratory will require different years of experience. It could be 2, 3, 4, 5, 15 years of experience, and so on and so forth. Now, 6.2.2b requires that laboratory shall ensure all personnel have the competence to perform laboratory activities for which they are responsible for. The first part requires that we establish the minimum competence levels, and we have mentioned the categories. Now, the next thing that the laboratory needs to do is to ensure that these personnel that they want to employ have actually achieved these competency requirements. Now we know, of course, this is a function mostly performed by the human resource departments or people and culture department, as many organizations call it. And it usually begins from needs assessment, where the human resource manager will ask you, if you're the lab manager or probably the supervisor in the lab, to tell them what is the need, what other staff do you want to employ, what additional personnel do you want to have, what do you expect them to do. So it begins from the needs assessment, and then in collaboration with the HR department, you will do an advertisement. Probably you want a molecular biology personnel, someone who has a background in molecular laboratories. Now, once you have sent out the advertisement, the time you are doing shortlisting, because of course you're going to receive so many applications, that's the first time that you'll be actually doing your first competence assessment. In other words, I'm saying competence assessment actually begins from shortlisting, because it is at this time that you'll be comparing what the people who have applied have in terms of their qualifications, their years of experience, against what you had indicated in your procedure for personnel management. So it is not usually said as such, but that is the first time that you actually engage competence assessment, because competence begins even before you see this personnel, before you invite them to come physically so that you can confirm. Now, the second part of competence assessment is during interviewing, because after shortlisting, of course, if you had 100 applicants, you'd probably shortlist 15 and then go ahead to interview them on one-on-one basis or even sometimes virtually. Now, during interviewing, because you're also confirming whether these personnel physically and when you're looking at them possess what you needed in your advertisement, that is part of competence assessment as well. And what we recommend at this point, actually all the way from shortlisting and interviewing, there's no way the human resource manager will do this alone, and just give you a personnel to continue working with. So they need to involve the laboratory managers or the quality officers during the shortlisting and interviewing, because that is when competence assessment begins. Once they give you personnel, you may not have much to do because you see they have already signed the contract. But if they engage you during these two activities, then you're able to advise as someone who has an idea of what you need as a person in charge of the lab. Now, proper induction and orientation then follows. That is after appointment, assuming you had 15 people and you wanted 3. Now, these 3 people will be taken through the induction and orientation. Usually that takes between 1 day to 2 weeks, depending on how big the institution is and the scope of work in the specific laboratory. What follows after the induction is the initial competence assessment. And this initial competence assessment is just to confirm, now that we have told this personnel, about our mission, we have told them about our vision as a lab, we have told them the kind of equipment we have trained them on this equipment, we will want to confirm whether our training was actually effective by performing the first initial competence to see whether they were able to get whatever we were telling them during the induction and the orientation. Now, this may take between 3 weeks to 3 months, again, depending on how complex the facility is. And ideally, these competence assessments should be based on the job description. If the first role of these personnel was to do sample collection, then the first thing we'll check is whether they have gotten it in terms of sample collection. If it was about, a quality management system, and we want to confirm whether they know how to draft procedures, we'll want to confirm during this initial competence assessment. Now, what follows after that, as we know, colleagues, is probation. And probation is when the staff is on a very close radar by the employer before they confirm them for employment. And as well, the staff is also observing the employer, so that if they're not very comfortable with the working terms and arrangements, they can also be able to terminate, this arrangement before they are actually confirmed. So this may take, again, probably 1 month, 2 months, 3 months. In some government organization, it may even take 6 months before you actually confirmed. Then what follows is the initial performance appraisal just before confirmation to confirm that, or to verify that this personnel, yes, they were inducted, they were oriented into the institution, they were okay in terms of competency, and they were given some time to think about the employment. Now, before we confirm, we want to see if this person was trained on how to do TB using the dense staining. They were competent about it. But how many slides can they actually analyze? They were trained on how to handle patients, these difficult patients at the phlebotomy area. But in terms of performance, are they actually able to handle these difficult patients with grace and with patience? Then once that appraisal is done, the personnel is confirmed into employment. And what follows now from there is continuous competence assessment and sometimes periodic. I'm saying continuous because competence assessment cannot just be done once in a year. It is something that you keep observing with this personnel across the whole period of their employment. And thereafter, you can do the performance appraisal. Many facilities will do it probably once in a quarter, once in a year, sometimes twice in a year. For some positions, probably they will be able to do this once in every 2 years. Now, part C of 6.2.2, the lab shall have a process for managing competence of its personnel, and that includes requirements for frequency of competence assessment. Now, when the standards tells you to have a process, it may just be a simplified workflow of how do we go about competence assessment. And sometimes you may even interpret that as a detailed workflow of how to begin and how to end competence assessment. And so what you need to do in this section of the standard is to develop, the procedure for personnel that includes competence assessment as part of it. But I also know there are some facilities that have a competence assessment procedure on its own. There's no problem. You can go ahead and have that procedure as a separate documentation. Now, what does this procedure include? Number one, it must tell us the methods of how we do it. You'll realize the standard is very silent on how. It just tells us what to do. So on how is where you indicate the methods that you're going to use to assess competence, the grading or the scoring criteria that you're going to use to say whether a personnel is competent or not, the responsibility For example, you can say the quality officer will be assessing all medical laboratory officers. Himself or herself will be assessed by the laboratory manager. The laboratory manager will be assessed by the lab director. And then the lab director sometimes may be assessed by the appointing authority, if probably that is the medical director or whoever it is. But sometimes we realize there is no one who is equal to the task to be able to assess the competence of this laboratory director. So sometimes they are the directors of the organizations themselves, or they are probably the investors of this facility, and therefore there may be no person to assess them. There's no problem. For as long as you're able to assess the people who directly, affect laboratory testing, then that should be sufficient. You'll also talk about frequency. Now, the standard is also a bit silent on how often we should be doing this competency assessment. So you can have these every once in a year, twice, thrice in a year for some positions. So that is what you will have in Part C. Now, Part D, finally, the lab shall have a documented information demonstrating the competence of its personnel. So when you hear the standard mentioning very carefully information, is to mean some of this information could be documents, they could be records as well. And these are some of the documentation that you can have to demonstrate that our personnel are competent. Number one is the shortlisting checklist that was completed during the time that you are, considering who to invite for the interview and who to leave out. Now that process should not be done, just like that. It should be a well-documented process because, like we mentioned, it is the first time that you are doing the competence assessment of this personnel. Of course, you are doing it before they come. The second document you need to have, and sometimes these first two are kept, in custody of the HR department, but we need to tell them to do these two activities very objectively and in a manner that can be demonstrated. So the interview checklist is another information that you can have. We can be able to show demonstrating the competence of our personnel. When you interviewed, what did you look at? What did you comment about the ability of this personnel to be engaged with us in this facility? Now, of course, the other documentations you'll have is the college or university certificates. This could be diploma documentations, BSc documentations, and others. You also need, and this is actually the initial documentation, straight away from college or from university, showing that this person has undergone, a 3 years program, training them on how to operate in a medical laboratory. And so we will have that document to demonstrate the capacity of this personnel. Of course, we know in different countries, they will do regulatory examinations at the end of their course, just to confirm that these personnel, from whichever university or college they are coming from, they are able to adhere to the basic, to the bare minimum regulations of the regulatory board. So that certificate of registration is actually a document to demonstrate the competence of the personnel. The practice license, if in your country you provide this, and then other training certificates that these personnel have prior to employment. Some may have undergone GCLP trainings, ISO 15189 implementation trainings, and others. The initial or the induction and orientation records, they're also part of those documentation that you can have to demonstrate that this personnel was taken through this program, to tell them about the institution, to tell them about how to operate particular equipments and all that. And then initial competency assessment, like we said, which should happen immediately after the induction and orientation activities are conducted. Thereafter, you will have these periodic and continuous competency assessment records, and then, of course, on-job training records, any other trainings, including this CME that we are having right now. Now, in terms of the methods, because like we mentioned here, in this Part C, the lab shall have a process of how to manage competence, how to do it. And of course, how to do it then requires that we have a proper way or proper methods of conducting competency assessments. So for us to optimize or to make good use of this competency activity, assessment activity, what are these methods that we can make use of? I'll talk about 5. There may be more, but allow me to just mention 5, and then we may be able to talk about any other thing later on. So first is direct observation. And when we say direct observation, is where the competency assessor reports on the personnel's competency based on exactly what they have observed them doing. And of course, this has to be confirmed with the requirements of the procedures, with the requirements of the standard, and any other guidelines. For example, when you want to know whether a personnel is good or they're able to apply the skills in specimen collection, you probably get a specimen collection manual, have the personnel go ahead and do the specimen collection, then observe whatever they are doing against the procedure. So you'll be able to confirm whether they're able to, observe the correct order of draw of blood. You can use this same method to check on the ability of a personnel to do equipment operation, to see how they are handling the patients, how they are doing internal audit. You can actually go and listen in on how they are asking the audit questions, what they are doing to record whatever they are told by the auditee. And you can use this method, especially where the interest is to see what the personnel is doing against the SOPs. The other method can be interviewing, where the assessor will have a one-on-one session with the personnel, and they'll be able to report on the competency of this personnel based on exactly what the personnel will give as responses. So you can use these well for internal audits. You can use it for safety practices. You can use it to check the understanding of the personnel in terms of policies and other SOPs. You can use this method to check on the understanding of the personnel's in terms of QC and troubleshooting algorithms, interpretation of results, and all that. The other method you can use effectively is the work output review. And this is also called documents and records review. And here the assessor will look at the documented work done by a staff to be able to report on the competency of this personnel. So it is used to confirm responses that were asked in an interview session, and is suitable mostly for training facilitation, internal audits again, and even results and reporting and release. So it's actually a common one to check on the competence of the personnel. Written testing is another method that you can use, but this has to be used selectively because we know very well there are personnel who are very good, in talking and saying things. But when you, challenge them with a question for them to write down, then you might be surprised that this personnel will not be able to demonstrate that ability so well. So you have to be able to use it selectively in some areas, especially where all the other methods are not working. So the assessor reports on the competency of the staff based on the responses given in this written test. So you can use these, especially after a training, to see whether the personnel got everything that they were taken through by the trainer. You can use it to check problem-solving skills. You can use it to confirm whether the personnel are aware of theoretical knowledge, of test principles and all that. And you can use it for different activities within the lab. Now, the other one is external quality assessment, or PT. And these are formal process where a lab analyzes prepared samples from an external provider and submits their results for independent evaluation against known target values or peer group means. So this is usually good because the assessment is done by an independent organization, And so it's very good to verify staff technical skills, for example, malaria microscopy, TB microscopy. If you tried to evaluate the personnel yourself, you might find probably they want to argue with you. You see, this is a 3+, but you are saying these are, of course, you don't count like that. Probably you are saying these are PV, but the personnel is saying these are PO. So if the evaluation is done by an independent personnel or organization, then it may end up being a very credible method of competence assessment. It is used also commonly to verify reliability of test methods. It is used generally to check comparison between our lab and others, and also identifying errors that are not routinely pointed out by IQC procedures. Now, allow me to stop at that in terms of the method. There may be so many others, but let me talk about or suggest to you some of the staff competency rating levels that we can use. I know some labs will use percentages and all that. That is also okay. So in this model, we have 3 levels: level 1, 2, and level 1, 2, 3, and 4. Level 1 is where the personnel demonstrate very little or no ability to perform a task. So when you ask them to go ahead and do a specimen collection, you can see them struggling, and in the end, they're not even able to get any sample from that patient. So for this particular personnel, they require retraining in the specific areas with this core, and then competency assessment can be repeated after some time. Now, level 2 is when the personnel, in your own evaluation as the competency assessor, demonstrate some ability to perform the task, but you can see they are not very satisfactory. You're not very satisfied with whatever they are doing, because you in probably 2 patients, one patient they'll be able to do the sample collection so well, and then the next patient, they fumble, and in the end, they just have to call another personnel to come and do sample collection. So that's that personnel, we would say they are level 2. So this personnel probably requires further practice under supervision, and then a competency assessment repeated. So we are not evaluating competence, to tell the personnel how bad they are doing and all that. We want to assess the personnel in terms of their competence, and probably retrain them or allow them to continue working, but under some specific supervision. So that is level 1 and level 2. Now, level 3 is where the personnel achieves the desired ability to perform a task according to you and the procedures that you have. Now, this is a personnel who is able to perform work independently, but you can't see them, being able to train others or probably to assess the competence of others. So we will say that our personnel is in level 3. They are just able to know, they're just able to do the task as they are, but not able to teach others or to assess the competency of others. Now, level 4 is where the personnel exceeds expectation. And of course, this happens for staff who have been there for some time, or staff who specializes in a particular section. So for a staff who exceeds expectation in performing a task, we would say they are level 4. These are personnel who can perform a task independently without any assistance. But of course, in laboratory, we say every result has to be verified by another personnel. But every review will always show that the initial result by this personnel were in line with the expectation. And this personnel is also able to teach others and can be able to assess the competency of others. So we will basically say that our personnel is a level 4 in terms of competency. Now, I want to show you a competency assessment tool which you can probably use to customize or to adjust whatever tool you are currently using. And it's a tool where, of course, you will have a page for every function or every section within the laboratory. It begins with the personnel name, the designation, and of course, their signature. Because again, if we just complete a competency assessment form without the personnel acknowledging that this is what was done to them and they were available, they know, they can attest, then no one will be able to trust the results of the competency assessment. Then in that form, you can indicate whether it is the initial or it is the periodic assessment, probably annual, quarterly, or whatever other frequency that you want to choose, and also the assessor's name. Now notice this tool has the competency assessment method, because again, for every activity you want to assess, it's good you tell or to record which method you actually used. Is it a direct observation? Is it a documents or records review, or what we are calling the work output review? Is it out of an interview? Is it out of a written testing? Is it out of EQA, samples analysis? Now, the other part is the levels, where you will indicate level 1, 2, 3, 4, as I have explained in the other slide. So it's a section like quality management system, where we expect all quality officers and probably actually all staff who work in the laboratory to be able to perform one or two roles in quality management system. For example, the first thing is competency, or in terms of familiarity with laboratory quality management system components. Is the staff aware of quality management system documentations? So if you used interviewing, because probably you interviewed them and you asked them to tell you the different documentation that we have, then you are going to write C as the method used. So you don't have to write the whole name, just write C. And if there's an evidence you can show, you can always write it in the next section, but you can also write a comment if especially it was an interview. If it was probably a document or records review, you can probably indicate the actual document that you saw, that they showed you. And then on the levels, you can either indicate, you can either tick 1, 2, 3, or 4. And you can do all that for all the activities in that particular section, then move to another section and do the same thing. For each of these activities, you have to indicate the dates. It is not always possible to do competency for everything the same day. So it's okay to write the specific dates that you assessed, the ability to probably handle customer complaints and appeals as a quality management system function. And then the personnel, like we mentioned, needs to sign for every activity they have been assessed on, and the assessor will also countersign. So you can do this objectively in this manner. So finally, just as a way of summarizing, some of the strategies that, or probably tips, let me call them tips for effective competency assessment. Number one, I know there are so many, but allow me to just mention a few. First is clearly defining the competency requirements so that the personnel can know from the beginning what are they required to achieve. And so we define this, like we said, under the procedure for personnel management. And we define this per function. So the receptionist, what should they have? The phlebotomist, what should they have? The lab director, what should their minimum competency levels, and so on and so forth. Now use multiple assessment methods. That will help you because, like I said, some personnel are not so good when you tell them to write. But when you interview them, you'll actually realize they know something. They have an idea generally. But if you just use written skills, you may not be able to get the best out of this personnel. Set measurable performance criteria. So like the staff is aware, I'll be graded as what, level 1, level 2, level 3, level 4, because I'm not able to demonstrate the competence, or because I'm able to exceedingly demonstrate the competence. So let the staff be aware of the performance criteria way ahead. And then document every assessment, because again, record keeping is very crucial. Use standard tools to ensure fairness and consistency, like the tool I showed you. Let this be the tool that will be used across board by all the personnel. Now, some of the activities may not always apply to all the staff, but let them know that the tool is standard. They'll be graded on what is applicable to them, and what is not applicable to them will probably be left blank. Now, engage staff positively, because again, staff competency and even appraisal sometimes are not used for the right purpose. They want to perform a competency assessment when you want to do away with a particular staff. So that's the only time you want to engage them for competency. So present it as a professional growth activity, not a fault-finding activity, and always provide constructive feedback after the activity is completed. And then use competency as an improvement tool and not a punitive measure. Staff will not cooperate with you, especially the next time you want to do this activity. If they realize that the last time you did this, you did not do it in a manner that is showing an intention to help the staff improve. And as a staff as well, always, discuss with the supervisor so that the end of this process does not end up being a punitive activity. Let's remind each other that, by the way, yes, I am not so good, in microbiology, not because I don't want to learn, not because I'm so ignorant, but probably because I need some more time in that particular section. So I may be a very senior personnel in one section, probably have worked in chemistry and hematology all my career life in that hospital. And so when you transfer me to another section, I may not perform so well because of that same reason. And so let this competency assessment, if you want to assess me in that other section, which I'm not very conversant with, let it not be a punitive activity, but an activity that is intended to help me improve. And then integrate routine operations. This is a competency assessment into routine operations, so that you don't have to wait until the end of the year to comment about the competency of a particular personnel. You want to, every time, be actively involved. If you're the quality officer, be actively involved with that personnel's file, especially the form on competency assessment. And keep, recording what you think about the performance of this personnel in this activity. Now, remember, some of the activities in the laboratory are not happening on a routine basis. You may not always be doing cholera testing, as a lab. And so if you wait until end of the year to comment about the ability of this staff to handle cholera materials, then you may not be able to get the right picture of that personnel. Or you may not even have the samples in December when you want to assess this as a competency. So as a laboratory personnel, as the person in charge of this activity of competency assessment, be always on the lookout on what are these activities that we can assess on an ongoing basis, or on other times apart from when you had probably scheduled them in your calendar. So that is it. That is what I want to stop it. These are my references. Thank you so much for listening to me. I don't think you have any questions, because this was quite an easy subject for everybody. So over to you, David. Thank you so much for the time.
Thank you so much, Mr. Paul. And thank you for the very informative, well presented and insightful information. We indeed have so many compliments in the chat box, and our members, our colleagues, our fellow professionals are so happy for the presentations. It was well presented. As we can see from our charts, there are so many compliments, and we may not read all of them for the sake of time. However, we can mention 1-2 questions. There are some few questions or maybe clarifications that maybe you can tackle them. Mr. Paul, if you're ready, I can read to you some.
Yes, go ahead, David. I'll be glad to answer the few questions.
Okay. Thank you so much. So the first question was given by Mr. Chrissy. What's the difference between induction and orientation? He needs a clarification between when you are inducting and orientating.
Okay. Do I answer one by one, or do I wait for more than one question?
I can combine, you can answer that, then I'll see which maybe others I'll combine. But for that, just give it a quick one.
Okay, very good. So very quickly, the difference between induction and orientation. So induction is what happens at the very first stage that the staff is joins the organization, where they are taken, they're taken through, the mission and the vision of the organization, and that general overview of what the organization stands for and what is expected of them. Now, orientation usually takes some time. It may not happen, in one day, because this is where you are taken through the specifics of every activity, every role in your job description, every equipment that needs to be run, to be operated on. You are taken through on how to use it. And yeah, so I would say induction is more generic about the organization generally. The orientation is now the specifics of every role in your JD.
Okay, thank you. That's well explained. We can tackle another one. One of us asks a question, is Mr. Alex. What is the best method of assessment and what factors should be considered? Sorry for that. He's asked, what is the best method of assessment and what factors should be considered in considering the best assessment method? So which method do you consider best for assessment? And at the same time, you can combine
Okay.
with, there is Mr. Alex who has asked, in case of a new laboratory that is new to QMS, what should be prioritized first, verifying laboratory methods or assessing the personnel for competence?
Okay, thank you. Let me handle those two. So which method is the best for competency assessment? I will not be able to say that this is the best method, this one is not the best method. It depends on the activity that you are assessing. For example, like I mentioned, if it is a specimen collection activity, there will be no need of doing an interview. For what reason? Just go and observe the personnel as they actually do it. So no best method, it only depends on the activity, mostly the activity and what you want to achieve as the competency assessor. Now, what should a new laboratory consider in terms of their QMS? Is it verifying the equipment or assessing the competency of the personnel? I would say all are important. But remember, no laboratory will operate without an equipment. No laboratory will operate without personnel. Of course, verifying an equipment would probably require some resources. Probably you may not be able to do the extensive verification as we know it, running 20 samples for accuracy, doing 20 repetitions for precision and all that. You may not be able to do the extent as required by the standard at the beginning. But at least for personnel verification, you don't require any resources. So probably you can start with personnel. And then if the personnel are okay, you can do probably minimal quality controls as you prepare your equipments for extreme or extensive verification.
Okay, thank you. Now on the same reassessment, there's a common question that is being repeated by most of us on the frequency by which we should conduct assessment or reassessment, as well as another staff has asked, how should competence assessment be handled for a new staff trained on a new equipment? Or at what point should you deem this staff, particular staff, competent? Do you have a frequency?
Okay,
You
thank you.
mentioned it.
All right, thank you. So first of all, in terms of the standard, our standard is very non-committal on how often you should be able to do competency. But just as a recommendation, once you have done your initial competency, you can probably do it annually going forward for a particular number of years. But then for these personnel who have probably been there for a longer period, you will probably consider to do their competency assessment maybe 2 years, every 2 years. But that will depend on what you want in your SOP. How do we handle personnel who have just been trained on an equipment?
Yes.
I think this is usually done by the engineers or the application specialists for a particular analyzer. They will train you on how to operate the equipment. They'll train you on the principles and all that. Now, the assessment is twofold. Number one is your understanding generally, like the principles of how these equipment work. Now, that may work so well by a written test. That's why many of them will give you a written test to do after the training of that equipment. Now, the other part is more practical, where they'll be able to observe you as you, configure the accuracy values on that equipment, as they see you prepare and run a sample of that equipment. So the other part is more observation. And for written testing, that can be immediately. For this observation, probably you can allow the staff maybe a few hours to 1 day to see whether they are competent on on handling that equipment.
Okay. There's an interesting one here that while we are doing observation, how do we ensure that there is no bias on that, or how can we stand to explain it in case of an audit and explain that it's not biased? And at the same time, maybe you can combine with one staff has asked also, for an instance, is it possible for a junior staff to administer competence assessment to a senior staff? And then finally, another staff has asked.
Allow me to answer those two first.
Okay. I thought they are related.
Okay, just say it. Okay.
Yeah, the last one, they are related because one asked, should we consider gender during assessment, competence assessment? Now you can tell me.
Okay, thank you. So how do we handle bias, especially when you're doing observation?
Observation, yes.
Yes, the best way to do it is to always make sure that you are observing against a particular SOP or a particular standard, so that it is not based on your own subjectivity, but based on what you have written in your own procedures or other regulatory guidelines. You may not be able to document, a criteria for every observation of every activity that you check. So as a quality officer or as a supervisor who is assessing competency, just be guided by the SOP and make sure you stick to the SOP to the latter. Now, secondly, on whether a junior personnel can assess a senior personnel on competency, yes, it can happen, depending on the section. Let's say, for example, you have this junior personnel who joined the organization and they specialized in malaria section. Now you have this senior personnel who has been working almost half of their profession in that lab in microbiology. And so they don't have much to say about malaria. But these other junior personnel have probably even undergone, WHO malaria training, and they are probably a level 1, level 2 microscopist. They can always be able to assess the competency of the senior for as long as they can be able to demonstrate that they are also competent in that particular area. On terms of gender, no, it does not apply. It doesn't matter. A lady can assess a gentleman can assess a lady.
Okay. Thank you so much. Maybe as we wind up, you can take this one. Kindly ask her what happens if a personnel consistently does not meet competency assessment. If a personnel does not meet competence assessments consistently, maybe you can combine it with if you are able to illustrate or give a summary of what you consider competency assessment cycle.
Okay, good. So what do you do with this personnel who keeps failing competency assessment? Okay, first of all, I illustrated in one of the slides, and I think I want to illustrate that slide again because it does not start with assessment as we know it. I want to take my colleagues back to this slide. Before we start complaining of this personnel who keeps failing on competency assessment, let us make sure we are involved from the beginning, from how the shortlisting was done to the interviewing and all that. If you're able to do that for all the personnel, then you're able to arrest, a personnel who is not competent from the point of shortlisting or from the point of interviewing. Otherwise, if we are not involved as a laboratory department and we leave these two roles with the HR officers, then we are likely to have these personnel who keeps failing on the technical activities. Probably the HR, recruited these personnel because of how they are talking, how articulate they are, or probably based on the looks and many other unnecessary factors. And then when it comes to technical activity, this personnel is not able to perform. So, but then what we do now that we have this personnel on board, we have probably to recheck on how we are training them. Probably we are not doing the right job in terms of training. Now, the other thing we need to check is, are we having this personnel for the right department? Are we placing the personnel in the right department where they're able to exercise all the capabilities? You're probably training this personnel on malaria, but probably don't have a passion for it. They're probably more passionate in microbiology or probably more passionate in chemistry, where it is pure automation. So I would not want to say that there is one direct method of dealing with a personnel who keeps failing on assessment, but we also need to check on the different roles that we can have this personnel perform. I'm not saying that we will fire the personnel. We can try to restructure the lab and have the personnel in the right department where they are more passionate about.
Okay, thank you so much. Maybe if we can take the last one. One of the staffs is asking, what are the qualifications of a lab director, bearing in mind that MedSoups are the laboratory directors in subsetting? Now that is maybe what the standard directs on who is a lab director. Maybe you can give a brief on that.
Okay, all right. So first of all, the standard is very non-committal on whether we should have a lab director or not, actually. Because the standard is saying the lab shall be directed by a person or persons, however named, with specified qualifications. So it is us as a lab to specify who we want as a lab director. In terms of competence, I would say we just need someone who can be able to lobby for the laboratory at the topmost levels in an institution. Whether that personnel is a laboratory person, a laboratory personnel by background, or a medical director in that institution, or even the medical superintendent in county facilities, it doesn't matter. For as long as they can be able to lobby for the laboratory and help us, achieve the goals that we want to achieve in our facility.
Thank you, Mr. Paul. You can take a little break so that we wind up before you give your final closing remark.
Okay, thank you.
Yes, maybe a mention or if I can, an addition of what you've just said on the standard application, especially for laboratory director and the management of the laboratory. The standard is open and the standard is contextual. Depending on how your laboratory is structured, the lab director will always be defined by the specific laboratory. Standalone laboratories will have a specific director of different qualifications, unlike what we have in a hospital-based laboratories. So, as we wind up, we want to thank all our members who joined for this evening's webinar. Thank you for your time and thank you for learning, and know this has helped us a lot. We've improved in one way or the other on our QMS knowledge. And we always do this every Tuesday and Thursday with the aim of improving ourselves in the professional perspective, as well as getting CPD points. However, we encourage all of us to be members of the association, KML Akamulso, and we are circulating links for joining, for registering, all going around in our WhatsApp group, our social media pages. And before we come to an end, we have our association president, Mr. Safari. Let's have him give us a word as we conclude. Mr. Safari.
Thank you so much. Thank you so much, Moderator David Kenani from the association. I want to take this opportunity to appreciate all members who are in attendance for this today's webinar, which has been very instrumental in empowering us towards quality management system. Remember, quality management system is what can distinguish us from other professionals in the hospitals. And I'm very happy that we are really strengthening our professionals towards quality management systems, because this has been an iconic performance or the distinct area which has singled the medical laboratory professionals in Kenya, and they have come up very clear that they are the champions of quality in hospitals. In most of the hospitals, you find that it is only the laboratory that is accredited, or it is the laboratory that is implementing steps towards accreditation in terms of quality management systems. All other sections in hospitals, they don't even know what is quality management system, and they are not doing anything to improve the quality of performance. So I want us to keep up this spirit so that whatever happens, we will always be considered as champions of quality in hospitals. So thank you so much, Paul Kahara, for really spearheading this and coming out very clearly. And our CPD team is really doing its best to ensure that those areas that our medical laboratory professionals have requested and have found themselves deficient and need more information are really lined up in terms of webinars. And we will continue bringing you top-notch presenters on the various areas that we are interested in. So we have a big lineup of many areas which professionals have requested, and this was one of them, and it has come out very clearly. I congratulate Paul for making it more clearer and ensuring that at least this clause 6.2 on personnel competency assessment is really engraved into our minds for the purposes of quality management systems. Finally, I want to continue urging our members and those who are not members to embrace Akamulso by becoming members. The links are being shared in these webinars, because though we are doing these sessions for knowledge purposes, we are awarding CPD points for those who are members of Akamulso. And it is very simple for you to become a member of Akamuso so that we continue strengthening our association and continue strengthening the sharing of knowledge to us, to all of us professionals. So I think with that, there is more information related to our upcoming annual conference, exhibition and scientific conference, which is happening in Mombasa between 14th and 17th of October. And that is also part of the CPD sessions for the association. And the award of points will continue when you attend such conference. So prepare yourself, register. There is also the conference registration link being circulated. Kindly register early so that you participate in this conference. And with those many remarks, I want to thank the organizers of this CPD session and the presenter, and I want to return it back to you, David. Thank you so much.
Thank you, Mr. President. Mr. Kahara, you can also give your parting shot as we finish.
All right. Thank you, David. Thank you, Mr. President, and all members. I'm so grateful for this opportunity once again. I think this is the third time that I'm facilitating a webinar here at Akamuso. And it is always a joy to share with colleagues and to listen to their questions. Like today, there were so many. Sorry, guys, for those I did not manage to answer your questions. There were so many, and the time was quite limited to be able to have another opportunity. But if you really have a burning one, you can share with me on my lines. They are still open, and we can be able to engage. Otherwise, I want to encourage Akamuso for the work that you are doing to educate our professionals. Everywhere I go, all professions and even non-healthcare professionals are now appreciating what the medical laboratories do. I want to thank this initiative of the CPDs. We are becoming known every now and then because of these initiatives. Otherwise, I want to ask all the members on board, if you are yet to join the Akamuso as members, please go ahead and let's all prepare for the conference ahead in October and go and interact and network and share. Otherwise, have a good night all, and may God bless you.
Thank you so much. To give a clarification and answers to some of the questions in the chat box and as well as the Q&A, you can reach us direct to our email, akamulso.akamulso@gmail.com. You can also reach to us through our WhatsApp group. And I also want to assure there is a member who has asked if non-Kenyans, citizens from the international community can join, those from Zambia, South Africa. Yes, you can join the conference. We are all accommodative and ready to learn with all of us. So as the link will be shared, you will follow through. The same way you register and give your details, that's how you do while registering for the conference, and you pay the fee for registration to the conference. And conference attendance, as the president has said, will be given CPD points as other than the knowledge that we learn. We get the CPD points as well as certificates for attending and for those presenting. Thank you for this session, and thank you for joining. And Mr. Paul, let's meet again. Until then, I've been your moderator, David Kenani. Let's have a blessed evening. God bless you.
Thank you, and God bless you too.
Looks like a real bat, but actually